Another breakthrough in rehab has been the use of a simple PVC pipe or a device like this that you can buy at Home Depot or Lowe's or any sporting good area to increase mobility of your spine. One of the most important things about finding something that works for spinal mobility is finding something that works. And oftentimes, going through wild stretches and different motions are difficult to do because they're not fun. I find that the PVC pipe or any pipes like this help out with a lot of different mobility exercises and stretching exercises because of the ability for it to have just a very simple, it's in your hand, it's a few bucks, cheap, and you can do a lot of different motions with it by just having a simple device that guides you through the process. So I want to show you a couple exercises today that you can do for your spine to help stretch, get more mobility through it. And that's something that can be done in a seated position. You can do it laying down. I'm going to do these standing. Just imagine you're doing them in a seated position. You can do them as well. But these are some simple exercises you can do to help create more mobility in your arms, in your spine. Now remember, when you start to look at the spine, you're going to always incorporate the legs or the arms to it because the legs and the arms are the extension of the spine. If you didn't have your legs and your arms, your spine probably wouldn't be very much of a good use to you. But because you are able to walk and move and do all the things you do every single day with your arms and your legs, your spine continues to become a place of stability and proper mobility. Like I said earlier, you don't want to have a ton of mobility in your spine, but at the same time, you don't want to have a super stiff spine either. Oftentimes, when the spine is not moving that well and you find that you're being stiff and it's becoming painful, it's usually because you're not moving it in a way that is gradually improving its flexibility and strength. A lot of times people will think with, how do I stretch out my spine? You lay on the table, do I do all these things with yoga? And all those things are fine and good, but this PVC pipe is such a simple thing that can help you get so much mobility from doing spine exercises all the time. If you have one at home, it occupies no space. You probably lose it if you think about it because it'll get moved around, put it in your garage, but it does help out create a lot of mobility in your spine. So let's start off with this simple pipe. One simple thing you can just start to do with it, just in your hands, in front of you here, you could even keep it close to your body, and as you could raise your arms up, just start to think about how you can get your arms behind your back a little bit. So as you start to raise your arms back lightly, you don't want to have any shoulder pain. If you do have any shoulder discomfort, just bring your arms in closer. The further you go out on this, the more you can feel it in your chest and in your spine. So you start off here and you just want to raise it all the way up and just breathe. So it's a simple thing like this. And you try to go as far back as you can. Now, at some point, as you're going further back, you're going to have to extend your arms further and further out. The further you extend your arms back, the further this goes back. So again, we're not trying to get this thing all the way back behind yourself. That's irrelevant. What you want to start to do is just have enough length backwards so you're stretching a lot of these parts of your lats, your rib cage, and your stomach and your core. As you kind of bring it back like this, another variation of this simple thing is you start to turn your body. You can do these seated. You start to rotate your body and twist. And the further you twist, you can twist further and you get more stretching. Granted, you're going to feel it in your ankles and your hips, but you start to rotate and twist. Now, as I'm turning with this pipe above my head, it's creating some stability, right? Because I have this above my head. So you're not herky-jerky, you're not moving around, you're just stretching. Now, some people may just kind of choose to have like it over their back like this, to turn like that to start off with, which is totally fine, right? You don't want to feel like you're creating a difficult turning environment where you're turning your body and you're not moving enough. But again, you're starting to move a lot of this. Some people argue and say, hey, it's a lot of hip motion, not enough spine motion when you're doing that. But again, we're talking about just getting the spine moving. We're not looking to identify and isolate the hips versus the spine yet. We're just trying to get those things all coordinating together and moving in a functional way. If that's one way, another one would be just simply having you turn side to side. Here, you're gonna get a stretch on the side of your body. So as I'm turning to the left here, my right side is getting a great stretch. And then you stretch this way. Again, a very good exercise to get the side of your body stretched out. And when you're doing this, you feel it primarily in your lats and the side of your body. So a lot of, I'll just give it to you right here through this process. Nice, simple stretch. Again, you could do this simply sitting down. Then you're going back and forth, you're breathing. And again, if you feel any discomfort with it, just back off. The same thing goes for back here. You could have the pole behind your back and slowly just lean back, right? So now you're actually just leaning back. You're stretching your arms a little bit. You see my arms are further back than my body, and you're just leaning back. Just nice and easy. And you could just kind of bring it higher if you want. You don't want to push it too far forward like this. That's not the point of it. You don't want to push your spine forward as you're doing it. Just letting the bar be back behind you and sort of leaning over it, right? Again, you don't want to do a lot of this head stuff, just nice and easy. You feel it out. If you want to watch, see how my thumb placement, if you put your thumb a little bit on the outside, you feel a bit more on your shoulder. Put your thumbs over, you feel like that. Another one is simply just hooking the pipe behind your arms like this. Sometimes if your arms bother you, it's not as easy to do, so you can just kind of have it hang lower. Just kind of keep it like that, right? Or you can have it like this, or you can have it like this. So now you're here, and again, you're just moving the spine with the pole, right? And I'll give you a side shot of this. It's just simply helping your spine move. Here I am, just kind of using the pole as a little push here. Nothing crazy. Just a little push. If you raise it a little higher, you're higher up. Be here, a little push. What's important about exercises like this is the pipe actually pushes on the spine, so you feel the bones and the pipe connecting to each other. When you feel the bones and the pipe connecting, you could feel the motion of the bones as you're doing it, right? It's like a little pressure on the bones. And that creates just a little bit of what we call proprioception or joint reception, where the joint and the muscles feel what you're doing. Sometimes when you walk and with your arms, for example, and you walk and moving your arms, you don't feel your arms necessarily. You don't pay attention to that. So you want to create a situation where you could even just feel it. And if you raise this pole higher and higher, if you can, you'll feel it in different areas. You could also go very low with it, all the way down to the bottom of your spine, and start doing things like this. Now I'm doing a lot of rotation. If I bring it back up, I could do side to side. And essentially your elbows are hooking into the pole. So if your elbows are hooking into the pole, you want to be careful that you don't sandwich the pole in your elbow and give yourself any discomfort, right? Like right in here, you don't want to have like a discomfort in your elbow crease. You just want to do it comfortably. So a lot of times if you feel that discomfort, just have to bring the pole down and just relax. Keep the pole right there. It's very simple to rest, and you can kind of bring it back up, bring it into your arms again, and you can start doing different variations of the exercises. Anytime you move and you feel any discomfort or pain, the good thing about the PVC pipe, you just take it off and drop it down. You don't have to worry about it. There's very minimal risk. There's minimal injury. You have that all very easily set up with the pipe. Those are some basic exercises you could do with the pipe. I wouldn't recommend doing very much more than those for right now. They're simple to do. Again, like I said, you could do it seated. You could do it even just wherever you are. I mean, you could be sitting outside or at your house, more likely at home where you're in an environment where you don't have a pipe like this. This is a bit of a fancy one. Usually the ones you get are just plain white color one, and they're very inexpensive, $5 or $6 on Amazon. Get something like that, play with it at home, and it'll help you create some mobility in your spine where you probably are not thinking about doing that, and it keeps you safe because it's not pushing too much in one direction over the other. And that's a spinal mobility exercise with the PVC pipe. I'm Dr. Vinod, and thank you for watching this video. If you like this content, please hit the like button, subscribe button, and the notification buttons for future content. I'll see you next time.